As the leading professional association dedicated to infection preventionists, APIC provides the resources, thought leadership, education, and comprehensive training to help you protect those in your care. More than 15,000 IPs globally depend on APIC to help them develop and manage top-tier infection prevention and control programs. Join APIC today and unlock exclusive benefits such as educational content, access to cutting-edge research via our journal, and networking with peers to propel your career to new heights.
You are listening to the 5-Second Rule podcast presented by APIC, the Association for Professionals in Infection Control and Epidemiology. This podcast is produced by the APIC Communications Committee and is intended to be a conversation between our hosts and professionals practicing in the infection prevention and control industry. You will learn and be entertained, but most of all, we hope you will be inspired by our community and the work of our peers. And now, on to the show.
Welcome to the 5-Second Rule podcast. We are your hosts. I am Lerenza Howard, and my preferred pronouns are she, her.
And I'm Kelly Holmes, and my preferred pronouns are also she, her. Hi, Lerenza.
Hi, Kelly. How are you?
Very good. Excited for the show today.
We have two guests with us on the show. Lori Crow holds a background in both microbiology and public health. She now works in public health emergency preparedness and response at a state health department. In that capacity, Lori is trained to prepare for and respond to all types of hazards that can impact public health. Cindy Prins is an associate professor in the Department of Population Health Sciences, College of Medicine at the University of Central Florida, and is a part of the UCF Infectious Disease and Travel Health Initiative. She is an infectious disease epidemiologist whose research focuses on infection prevention and control in both healthcare and non-healthcare settings. Welcome to the show, Lori and Cindy.
Thank you for having us.
Yes, it's great to be here.
Welcome, ladies. Thank you for joining us. Between the two of you, it sounds like we have some really good expertise on the phone. Would you mind telling us a little bit more about your background and personal and professional experiences with hurricanes?
Sure, I can start. This is Cindy, and I've lived in Florida for about 30 years, so I've had quite a bit of experience with hurricanes during that time period. I was actually in my first year of college, had just moved to Florida when Hurricane Andrew hit, and I drove a friend and her younger sister who had been visiting college back to their home in Cutler Ridge, which was near where the storm made landfall in Miami. And luckily for them, their house had no major damage, but their neighborhood was completely devastated. And that was really my first experience as an adult with how powerful these storms can be. And then over the years, I've volunteered at a hurricane shelter during a storm. And then I also did volunteer cleanup. And I've done personal cleanup as well in areas that were affected by storm flooding. And I've also worked in infection prevention and control, of course, in Florida for several years. And luckily, we didn't get any hurricane damage during that time, but hurricane preparation was certainly part of the job.
Absolutely, for sure. And then, Lori, could you share your experience with us?
Sure, thank you. I work for a state health department in the Office of Public Health, specifically in the division of that office that deals with public health emergency preparedness and response, and that's what we do. And we have a all hazards approach. In other words, we prepare for and train for all types of hazards, whether it's chemical release, biological terrorism, but the two most common types of hazards that we encounter and need to respond to are hurricanes and flooding. So we really have two phases to our jobs. In the preparedness mode, we're doing trainings, we're forming community partnerships, contracts with vendors. And then when the hazard inevitably comes, we switch to response mode. And in that mode, we physically relocate to the Emergency Operations Center where we respond to needs as they are occurring. In other words, we're putting all our preparedness plans in place. And for a health department, our perspective is protecting people. We're not into saving buildings or roads. We're looking into protecting the health of people during an emergency. And for a hurricane, we usually go into that response mode at least 48 hours in advance of landfall. And hurricanes really can present, it really introduces a lot of chaos in the environment, which, then you have a lot of new opportunities for infections to occur. So Sandy and I really feel that infection preventionists do play a role in both hurricane preparedness and response.
Lori, thank you for sharing your insights, and you as well, Cindy, sharing with us your background as it applies to this topic at hand. But more about me is that I'm an infection preventionist. I've lived in Chicago my entire life. Therefore, I have no experience with a hurricane. I can only visualize what could potentially be, done from an infection prevention lens based on what I see and visualize on my TV screen, right? So for those of us that don't have experience with these forms of or types of storm systems, such as a hurricane, share with us what are some of the infection control measures that should be taken by infection preventionists, including their healthcare facilities, both before and during a hurricane.
So this is Lori. I'll go first, and I'll talk about infections that can arise at home. And I think of them as in 4 different categories: gastrointestinal wound infections, respiratory infections, and mosquito-borne infections. So gastrointestinal infections can arise from, unsafe water. So if there is a boil water advisory, do people know how to boil and store water so that it's safe for consumption? Also, food spoilage. Now, the biggest impact really from a hurricane are extended power outages. So do you have a good food safety plan in place where you know when it's safe to eat the food from your refrigerator and when you need to discard it? And generally the golden rule is if your refrigerator has reached 40 degrees Fahrenheit for at least 2 hours, then that food needs to go. So creating that food safety plan can prevent gastrointestinal illnesses from food spoilage. Also, contamination with floodwater. Floodwater may contain sewage. It may contain viruses and bacteria that got, from the soil that got mixed up with the floodwater. So any food or wooden cutting boards that come in contact with floodwater really needs to be discarded. So also teaching people how to safely or properly use a disinfectant and what's the difference between a disinfectant and a cleaner is important, and the need for clean hands as well. So as far as wounds go, there's after a hurricane, there's tons of debris around. So there's always a good chance for a scratch, even it looks minor at first, but if there's also floodwater around, that wound can get infected. So knowing how to keep wounds clean and using waterproof bandages would be important for infection prevention. But also there are puncture wounds, and then we're concerned about the transmission of tetanus. So keeping up with tetanus vaccinations could also be part of infection prevention for a hurricane. And then respiratory infections. So at home, we worry about mold in terms of respiratory infections. So if a home gets flooded, mold can set in within 48 hours. So prompt cleanup, removing wet carpet, even wet drywall, is necessary to prevent mold infection or mold proliferation in the house. So anybody who would be susceptible to mold should not be present for flood cleanup. And then also knowing proper PPE if you are going to be involved in cleaning up after a flood. So having an N95 mask, for example, would be important. And finally, mosquito-borne infections. So immediately after a hurricane, you don't really have to worry so much about mosquitoes because the winds may have taken care of a lot of the adult mosquitoes. But about 2 or 3 weeks after a hurricane, you can see a proliferation of mosquitoes. Although most of those will be nuisance mosquitoes, some of them can carry diseases. In fact, there was a significant increase in West Nile encephalitis after Hurricane Katrina. So having insect repellents and removing standing water around the home would be important for infection prevention for hurricanes. So our paper does go into more detail about prevention measures at home and also specific illnesses and pathogens.
And so Lori gave a great bit of information about at home, and a lot of that you'll find may be related to healthcare as well. So infection preventionists, should be part of a facility's all hazards risk assessment. So Lori said before about the Emergency Operations Center that they do all hazards risk. And that's what a facility should be doing as well. So you're not necessarily just looking at hurricanes, but you're looking at any kind of disaster that it can occur, and then you're ready for anything. So IP should help develop the policy, the communication plan. They should be part of that training and testing of the response as well. And then there are a lot of different issues that can arise from hurricanes that can cause infections in the days and even the months after a storm. So before the storm, facilities need to plan for power and water outages, and most large facilities will have backup power, but smaller facilities might not have that. And so what's the plan for hand hygiene if there's no water or if there's a boil water advisory? And patients may not be able to shower or even flush toilets if the water is out. So these are important things to plan for. There should be a plan for how water leaks and floods will be managed. So flood water may not be clean water. So that's an added infection control concern about keeping people out of that water and ensuring it gets cleaned up quickly if possible and appropriately. And then if the power is out, facilities need a plan for feeding patients, for making sure that food safety practices are followed. If there is a boil water advisory, there needs to be a plan for using paper plates, plasticware, paper cups. And then if a facility wants to still use their food trays, they need a way to clean them. So this is all advanced planning. It's so important. And then a communication plan is really important in a healthcare facility, especially during and immediately after a storm. So there needs to be communication within the facility, of course, but also to and from the facility to the local emergency operations center. And then after the storm, IPs need to be in touch with facilities personnel to make sure that any kind of building materials that got wet are mitigated correctly. So Lori talked about, the possibility of mold growing on some of the building materials. And that's certainly a major concern in healthcare facilities where we have patients that may be at high risk for poor outcomes if they do get a fungal infection. And then if there was a boil water advisory, equipment that uses any municipal water may need to be flushed, and filters may need to be changed as well once the water comes back on before the equipment gets used again. And then IPs need to keep the storm in mind when it comes to surveillance activities afterwards. So they should be on alert for things like an increase in healthcare-associated fungal infections from contamination of the facility, or Legionella from plumbing disruptions. And Kelly, I know you have a lot of experience with helping facilities prep for and manage hurricanes. So what has your experience been?
Cindy, you really hit all the highlights between you and Lori. I agree that preparedness is key. Within the infection prevention department, it kind of depends on how big your facility is, how many IPs are part of your team, and then that advanced planning of who is going to be the A team, so who is going to ride out the storm, and then who would be the B team, who would then come and relieve the A team after the hurricane. And so from my experience, the people who are riding out the storm, if they're requested to by their hospital, they're really involved in all of those things that you were talking about. And then you're watching the storm come in, and then you're dealing with issues as they arise. So for us, it's been a lot of water intrusion and really trying to clean that up quickly and get the building components dry so that we don't then have mold. And then, walking around, making sure that staff is okay. You might have some floating staff around. So making sure that they know where, all the departments are, where the patients, need to go, and making sure that if they have any questions, that those are answered. And we've also been part of, like the snack brigade, and trying to raise spirits and keep everybody fed and happy. So we'll take snacks around and, just kind of get a pulse on what anybody needs throughout the building during the ride out the storm. And then it's ICRA after ICRA after ICRA when the storm has passed.
Wow.
And how can we patch up and move on with, business as usual. So that's really great. Thank you, Cindy, for delineating all that out. And Lori, I love your public health perspective and, how it is so relatable to what we do as infection preventionists with the food safety, with, the water intrusion and preventing mold spores within the facility as well. So I would love to hear from both of you, some of the lessons learned. I know, Lori, you mentioned Katrina, and Cindy, you mentioned a big storm as well. So, what have those big storms taught us, and how has that helped us better prepare hospitals and communities? And then, how does public health engage hospitals when it is a terrible situation like Katrina?
So, yeah, public health, we're interested in populations. So we always want to protect the population. So you mentioned lessons learned. And I'll just say, after every incident, when the deactivation occurs, we have debriefings, usually multiple debriefings. We write a formal after action report. We then modify our trainings and exercises accordingly. And after every activation in every single hurricane, there are always new lessons learned. And you mentioned Hurricane Katrina. There was a mega shelter in Houston housing evacuees from Hurricane Katrina, and they experienced a norovirus outbreak. So you can certainly think that affected and influenced a playbook in terms of preventing infections in shelters. And protecting communities. So think of the role of the infection preventionist in protecting communities and preparing them for hurricanes. And I really see that, IPs play a role as public health educators. When hurricane season is coming upon us, and the Atlantic-based hurricane season runs June 1st through November 30th, so we're still in it. But right before hurricane season starts, we're educating people on, hey, you get your emergency preparedness kits ready, check your generators. And this is a role or an opportunity for the IP to play in, say, hey, don't forget to add these infection control measures to your emergency preparedness kits, like N95 masks and other PPE for flood cleanup, waterproof bandages for any cuts to prevent wound infections. Make sure you have a disinfectant and you know how to use it properly, and hand sanitizer, and maybe some face masks in case you have to evacuate to a shelter. So hurricanes or communities can be better prepared for hurricanes through some public health education by IPs. And you mentioned, Kelly, about public health engaging hospitals. Hospitals generally will have their own emergency operation plan, but where a public health department can assist would be, for example, in an evacuation. Let's say you need to evacuate a hospital or a nursing home. A public health department would find, locations in other states or maybe elsewhere in the state where to house these patients and transport these patients. In fact, just recently, we extended an offer to a neighboring state that was being targeted by a hurricane, that we could accept so many nursing home patients and hospital patients if they needed to evacuate. So other than that, I think hospitals generally have their own emergency operation plans.
I think from the hospital perspective, again, it really is about planning, and it's honestly about planning for the worst case scenario in my mind. So when we think about Katrina, the damage from Hurricane Katrina was really about water more than it was about wind. And the flooding not only creates issues with power and with water supply, but it also means it may take a lot longer for those services to come back online because you may need to wait for floodwaters to recede. So, a storm can roll in and roll out in generally a few hours, but that may not be the duration of the emergency. So that preparedness plan really needs to cover more than a day. And I think another lesson that we just learned with Helen was that places that may not normally expect to get hit, they probably need that plan as well. So we saw that Helen went, inland in a different track than we normally see hurricanes go. And that created obviously a lot of issues that people know about, huge amounts of flooding in some areas. And, those aren't areas that normally think of getting hurricane damage. So, facilities in other areas of the country need to be prepared for this kind of event to happen. And there's also a need to be realistic about a facility's ability to withstand a storm. So during Helene and Milton, both of those affected the Tampa Bay area in Florida this year. And Tampa General Hospital used a really cool anti-flood technology to protect their facility. And the facility had a high risk of flooding because of its location. They can also generate their own energy, so they know they can continue to provide services during and after a storm because they have these measures in place. If a facility doesn't have those protections, though, they need to consider whether they need to evacuate some patients prior to the storm.
Absolutely, everyone. Thank you all for your insights and this, depth of knowledge. I'm surrounded by, Lori, Cindy, and Kelly, who are amazing, I would say experts related to infection prevention and control response focused on hurricanes. I'm just here absorbing all of the knowledge from you all. And I think that that's, an interesting point to note, Cindy, with climate change in reality, some of those institutions and regional areas truly need to consider the implementation of risk assessments now that they could potentially be in the path of a hurricane or hurricane damage, right? But I do want to, pose the question related to some of the things, from someone who's never dealt with or been involved in a hurricane, the financial aspect, or not even financial, but the resources needed to adequately address a hurricane and or afford to evacuate if necessary. And I just wanted to highlight the point that according to the United States Census Bureau, 11% of people live below the poverty line. And of course, many articles have reflected the wage gap within the IP profession. Of course, that's dependent upon their geographic location. So saying all that to say that some IPs, who may have been experienced the devastation of a hurricane may not have the resources themselves, to support their own personal lives, let alone to provide resources to their respective facilities. But I just wanted to know from your purview, Cindy, we'll start with you. What can healthcare professionals, including IPs that may experience, the devastations of a hurricane, what can they do or what resources can they utilize to overcome any barriers, including the ones that I just noted?
Yeah, thanks, Lerenza. I think that's a great question and a really important question. I think in any area when we're faced with a storm, you'll see in the days leading up to it these pleas for people to, if they're in evacuation zone, to get out. And it is always a challenge to get people to heed those pleas. And it's for a number of reasons, and economic reasons can be part of that. For most people, what I'll say is they don't actually have to travel far to get to a shelter. So, a shelter may not necessarily take you completely out of the storm's path, but these are buildings that are expected to weather the storm better than your own home. So a lot of times it's just about getting out of a flood zone or leaving a manufactured home that may not withstand storm winds very well. Some people may not have transportation to get to a shelter. I noticed this year the Florida Division of Emergency Management offered free Uber rides for people to and from shelters. So that was a really critical lesson we've learned over the years about making it easy for people to get to shelters, not having barriers in place for them, to say, great, you want me to evacuate, but how do you think I'm going to get there? And how do you think I'm going to get home? For some people, they worry about their pets. I have pets, and I certainly think about them when I'm doing my own storm preparation, and our healthcare workers may have pets as well. So there are shelters that are pet friendly, and it's important to plan for your evacuation with pets. Do you have carriers? Do you have everything that they need for you to be able to leave and take your pets with you to a shelter or to a hotel? It's also important for healthcare workers to make that plan for their pets if they're going to be stuck at work. So do you have a friend or a family member who's going to be able to watch your pet during the storm if you happen to be working, so that you're not worrying about them and not trying to, leave work or not able to concentrate because you're worried about, your fur baby, your pet. Medical needs shelters are also available. And for IPs, I think this is really important for our patients. If someone needs oxygen therapy, if they need assistance with taking medication, or even if they require some kind of isolation precaution, those shelters can manage that. And in Florida, people can pre-register for a special needs shelter. And again, that will also guarantee them a ride to and from the shelter. And then one more thing I saw this year with hurricanes was a lot of messaging that people who evacuated, that the state would make every effort to get them back to their homes as soon as possible. And this is a really another important point, because some people don't want to evacuate because they worry that they're not going to be able to get home quickly. Lori talked about, mitigating the damage after the storm. You want to do that fairly quickly. And if someone's worried that they're not going to be able to get back in time to remove that wet drywall and to, minimize the damage, then they might not decide to evacuate at all.
Lori, I'll hand the floor over to you. Same question.
Yes, I'd like to Cindy made a really good point about the transportation. So I'd just like to add a little bit to that, say from a health department perspective. So you issue an order of evacuation. So, and does everybody have the means to get to a shelter, much less drive further out of town and go stay at a comfortable hotel? So when you issue an order of evacuation, you also need to consider the area where the order is issued. Is the hurricane heading to an urban area where you may have a fair percentage of people who don't have their own vehicle? So that's when we need to bring in buses to bus people to shelters. But we also need to communicate to them not just about the evacuation order, but where to find the bus or where the shelter is. So then we need to consider the languages that we're using to push out public health information. So English may not cover it for all residents. So are you using Spanish as well as English in your public health messaging? But you also need to know your state in advance in different areas. For example, we might push out information in English, Spanish, and Vietnamese for a particular area of our state, which may not be necessary in other areas. So that's part of your preparedness. And also having translation services ready. You have these vendors lined up beforehand as part of your preparedness, so that whenever you need to push out your public health emergency information in different languages, you have those vendors lined up and can push it out quickly.
That's fantastic. And I love hearing about all the resources that are available. And I have seen that evolve over time, having lived in the Texas Gulf Coast for about 10 years. Katrina really did have an impact. And then I think people have learned a lot since then. And so it was really nice to hear, Cindy and Lori, from your firsthand experience, the outreach that goes on to get people to a safe location. So we have talked about what to do before the hurricane, kind of, what's happening during the hurricane. And we've touched a little bit on the aftermath, but could you please expand on that a little bit for us about, infectious disease incidents or things that may be challenging at home and at the hospital after a hurricane?
Yeah, this is Cindy, and I can start with the hospital challenges that we may see after a hurricane. I think beyond what we've already covered, I think home care can be a challenge post-hurricane, especially in rural areas where they may not have power, and not having power may also mean that they don't have water. I'm on a well, and when my power goes out, I'm without water. So I have to plan ahead for that. They may also have septic tanks, and I did a sudden, oh my goodness, this year and got someone to come pump out the septic tank right before the storm because I suddenly worried that it had been a while and I didn't want to see that appear during a storm. We also saw the challenge this year of supply shortages, and specifically the IV fluid shortage that we're still going through right now. That may be a little bit harder to predict, but, it's still something that we need to think about in the future, that, where are we getting our supplies from and what areas might be affected by a storm that might actually mean that we're going to wind up with supply shortages for some time afterward. And then I'd also mentioned surveillance for healthcare-associated infections post-hurricane, but IPs can also help educate healthcare workers on what infections people might present with after a storm. So right now, there's been a surge in cases of dengue fever in Florida. We see cases once in a while, often cases that are brought in, but these are, locally acquired cases. It's not a really common illness for us, so alerting healthcare workers to the possibility after a storm may help with diagnosis. And then the same is true of vibriosis. We're seeing an increase in cases now in Florida as well. So just, going and talking to the emergency department and saying, hey, as an infection preventionist, here's what I expect that we might be seeing after the storm. Let's keep an eye out for it.
Yes. And Lori, same question to you.
Yeah, so you think of what is the challenge, and I think of one word, and it's communication. So I imagine I'm in the Emergency Operations Center, and we're responding to a hurricane. It's in the aftermath now. And communication to the public is a challenge because in the midst of a disaster, people are stressed and they are not as receptive to information as they are otherwise. So that is not the time to start talking about infection prevention at the home or at the shelter. So infection preventionists really have a role in the preparedness and educating people beforehand, but they should also be trained in crisis communication, like public health emergency preparedness and response people are. We're trained in what can be communicated to the public, what's realistic for them to absorb and take in and apply. And usually you keep it real simple. You just have a few points. So being trained in not just preparedness, but also response. So IPs can learn the incident command system, which is a structure and workflow on how an emergency operations center works. And they can also learn that crisis communication because they are the subject matter experts to lend advice on, shelter administrators, how to prevent infections within the shelters. Multiple boil water advisories are very common in the aftermath of a hurricane. So IPs, are they pushing out information to the public on how to safely boil and store water? They may be working with a public information officer to supply that information that then gets pushed out to the public. So infection preventionists have a big role on the preparedness side, but they also have a role on the response. And being trained in that crisis communication would be key.
Absolutely, Lori and Cindy. And Lori, you bring up a good point on specific crisis communication. And I'm not sure if one has already occurred, but I think that that's an area of opportunity in educating IPs on exactly, some of us have experience with incident command, but specifically that crisis communication, because of course we wouldn't want to be in a crisis trying to figure out how to effectively communicate with stakeholders. I do want to transition to more so of a conversation related to assessing organizational preparedness. But before we do that, Kelly, I want to garner your insights, more of your experience related to this. Tell us the story about the Bucket Brigade.
Oh, yes. So this was a hospital that lost water completely for a period of time. I believe it was 48 hours. We had no running water. So there was a memorandum of understanding with the local water company. And so we were eventually able to get a water tanker delivered to the hospital that we could use for our water source. But between the arrival of that tanker and when the water went out, I think I was in the elevator with the plant operations man at the time. And he was like, "Hey, did you hear?" And I was like, what? I'll never forget that moment. But, so immediately we had to think about how are we going to wash our hands? And again, the communication message changed, as we tried one process and it didn't work so well. And then we had to move to another process. But the CDC does have really good infographics on how to set up like a large spigot. It's like those Gatorade containers that you would have at a sports game, and filling that up with water over a bucket and having your soap and your paper towels to wash your hands with soap and water when you needed to. And then we would follow up with the hand sanitizer after that. But we were also unable to flush the toilets. And the toilets were not the type that have the tank in the back. So we were uncertain how to start flushing those toilets. So it started out with red bag trash bags inside the toilets with kitty litter. And so the staff and the patients were using those. And as you can imagine, it was not a very staff were not happy, patients were not happy. There was not a lot of satisfaction going on. So we had to quickly pivot. And what we wound up figuring out is we could do a utility flush on those toilets. So we got the 5-gallon buckets from Home Depot, filled those up with water from our water tanker, and then we were able to pour those directly into the bowl, which would create enough pressure to do a utility flush. So we had a bucket brigade that was set up pretty quickly around the hospital. And so like Lori and Cindy were both pointing out the hazard communication and the importance of that. So making sure that everyone within the facility could communicate which toilets needed to be flushed. We came up with a signage system, green and red. If it was red, we knew the bucket brigade needed to visit that spot. And that also offered a little bit more privacy to both the patients and the staff. So yes, I would not, I wouldn't want to ever go through that again, but it is something to think about because the hospitals can lose water no matter where you are in the country, whether it's from a hurricane or a frozen pipe or, a utility failure. So, think about all of those water needs. And the CDC does have really good resources to help you estimate how much water you would need in that kind of situation.
Wow, Kelly, thank you for sharing that with us. That's a phenomenal story and skills that you've developed in being the bucket brigade in your IP tool belt.
Yes, we had to add a little bit of laughter to it. It's the only way to get through sometimes.
So Lori and Cindy, I want to know from your purview, and Lori, we will start with you. So what are some resources that are accessible to IPs that they can utilize to assess their organization's preparedness for hurricanes? And in your response, if you could share, the comparison of that organizational preparedness from the angle of a well-resourced institution versus those that may not have those same level of resources as well. So Lori?
Yes, in terms of assessing preparedness, we do a jurisdictional risk assessment, every 5 years to assess our readiness to hazards, to all types of hazards. So you can very easily add, questions in the JRA or the jurisdictional risk assessment around preparedness in infection control in different settings, whether it's healthcare, at home or in shelters. But as far as resources for the IP, like in preparedness and as well as in response, the CDC has a number of good resources. There's the CDC's preparedness and safety messaging for hurricanes, flooding, and similar disasters. That's a good general guide covering a little bit of everything. And there's a number of fact sheets that the CDC puts out. There's safe diapering in a shelter, preventing gastrointestinal illness after disaster fact sheet as well. And foodsafety.gov is a very good resource to help people create a food safety plan. And then when in response mode, paying attention to all those boil water advisories would be also a good resource as well. And I'm sure Cindy can add quite a few things to that list.
Yeah, thanks, Lori. There are definitely a lot of different resources. And, I want to be mindful of Lerenza, you mentioned facilities that are better resourced versus facilities that may be under-resourced, but all facilities should have an emergency management plan. There should be plan and policy in place no matter what. And so looking at those CDC resources that Lori mentioned, but I would also say look at your state and local resources because they may be more specific to your area. Connect with your state's emergency management group and also with your health department, especially if you're under-resourced and you feel like, boy, I'm not sure how I'm going to do this. They may give you some ideas of how you can plan ahead. Another thing is to connect with other IPs in areas that get storms and ask about their planning and their policies. So, you can go on the IP talk that APIC has and just post like, hey, who has, specifically a hurricane plan? What are you doing to plan for these storms and to respond to them? And then I got to put in a plug for the APIC playbook, of course, on IPC for shelters during disasters. Share that with your local emergency management group and make sure that they share it with shelter managers as well.
Oh, I love that. All the playbooks are very, they get to the point. You can open it up and find some actionable advice right away. And, I think just to add to that, for IPs in healthcare facilities, anticipating a boil water or anticipating a water failure, like get with all of those manufacturers for your sterilizer, for your automated reprocessors that you might have in endoscopy, dialysis. Those are key folks that you need to talk to about the filter changes that you mentioned, Cindy. And, can we still use our sterilizer if it's in a boil water? The manufacturer might have guidelines for you to say, yes, you can, or no, you can't. And then when it's over, you need to change this filter. So, proactively kind of knowing what the role will be before the storm hits, will save you some stress for sure. But so ladies, this has been very educational. And I just wanted to ask, are there any final takeaways that you would like to share with us?
Yeah, this is Cindy. So I think I just want to emphasize that hurricane planning is a year-round activity, which, Kelly just mentioned, thinking about those things that you're going to need and maybe even having a notebook with print copies in case your power goes out and you're not going to be able to look up a manufacturer's IFU. So do that year-round planning. We have a hurricane season. It runs from June 1st to November 30th, but so many of these infection control issues that we've talked about can be applied to other storms during the year. So being prepared just means thinking ahead of the possible scenarios. There are always take-home lessons after an emergency event. So, don't forget that debrief after a storm. Look at what went well and what could be improved, and then record it. Write down, what did you do? What worked and what didn't? Because those lessons learned need to outlive your time at a facility. They need to be available for the next person to benefit from. And then make sure as an IP that you are part of the planning and practicing of your disaster response policy, since infection control can be a major issue with storms. And one takeaway for me actually from the COVID pandemic is that it really took a major event for people to realize what IPs do, sometimes even within the facility, and how knowledgeable we are about issues across the healthcare realm. So, we need to speak up. We need to make sure that healthcare administrators know that we're important to hurricane preparation and response. And I think, Kelly, your bucket brigade story also reminded me that it is so important to just go talk to people throughout your facility during the year, get to know everyone, because you do want to be in the elevator and, have the person say, wait, that's infection control. I need to let her know that our water is out in case she's not aware.
And Lori, what about you? Any final takeaways for us today?
Sure. I'll just say that I've been a Gulf Coast resident for most of my life. multiple states along the Gulf Coast. So I have not just professional, but plenty of personal experience with hurricanes. And that does include Hurricane Katrina. So in the title of the paper Cindy and I wrote, we have the word chaos, and that really is appropriate because chaos does describe it well, and stressful is not a strong enough word. So imagine having your life turned upside down really overnight. You've evacuated to a shelter with your family. Cell service is spotty, but you're trying to check on your home and other family members, and you start developing symptoms of a gastrointestinal illness you acquired at the shelter. I mean, you don't need that. Or you're at home ripping out wet carpet, you get a cut, the next day it looks really inflamed because it's infected. And you can't get to your doctor, you don't have time, maybe cell service is down, you can't even find out if they're open yet. Do they have power, and is the office even open? So again, this is the last thing that hurricane victims need. So IPs really do have a role to lessen the burden on hurricane victims by, not having to deal with infections on top of everything else, because hurricanes by themselves are really enough.
Absolutely. I thank you both for sharing your knowledge with Kelly and myself. And I know I have a plethora of takeaways, especially as an IP who's never dealt with this natural disaster, and I hope to never have to deal with it, to be quite frank with you. But you all shed light on absolutely in these types of situations, the pertinence of having effective modes of communication and being an effective communicator as an IP, but more so establishing those relationships, not only internal to the healthcare facility, but within the community, right? Because we're the IPs, but we're not the IP police. Therefore, just partnering with the public health emergency and response is absolutely key. And noting that IPs have a role in preparedness, therefore it's integral to have that appropriate risk assessment in place and instituting a disaster response policy. Lori, Cindy, I thank you for your time.
Thank you very much for having me. It's been a pleasure.
Thanks so much.
Thanks, Lori and Cindy.
Thanks for listening to APIC's 5-Second Rule Show. We want to hear from you. Visit us at www.5secondruleshow.org. That's with the number 5, where you can contribute to the conversation. Make sure you subscribe and rate us wherever you listen to your podcasts. We're so appreciative of the hard work each of you do every day to make a safer world through infection prevention. Remember, IP stands for Important Person. You are awesome. Stay safe, and we'll see you next time.